Hello, welcome to You Will Bear Witness. We provide information about PTSD and child abuse. Today we're going to be discussing the two types of PTSD and where you can go to find help. Content is for information only and is not intended to replace professional help. Please seek professional help appropriate to your country. There are two types of PTSD that are significantly different. Complex PTSD and PTSD are often used as interchangeable terms, but in reality they are very different disorders, therefore requiring very different treatments. Both are caused by trauma and can lead to considerable damage to the sufferer and those around them. One is no less burdensome nor damaging than the other, but the symptoms and the reasons for those symptoms are very different. To recover from either disorder, one must understand the symptoms to move forward and find effective treatment for your particular condition. PTSD stands for Post-Traumatic Stress Disorder. It is often associated with war veterans and those returning from combat situations. It is also a mental health condition characterized by witnessing or experiencing a traumatizing life event. This event might be childhood abuse, a car accident, witnessing a murder, or another traumatic event such as an armed robbery. There are many events that can cause PTSD. The key thing to note here is the cause is a single event, rather than a series of events. This one event impacts immensely upon one's life, resulting in severe and lasting psychological damage. Common symptoms may include nightmares, severe anxiety, flashbacks, and obsessive or uncontrollable thoughts, and dissociation may occur. These symptoms may occur immediately after the event, or they may not develop until years later. There are 4 types of PTSD, including intrusive memories, avoidance, adverse changes in mood and thought, and emotional reactions and physical changes. Strong reactions such as fear, horror, anger, sadness, and hopelessness are natural after events like these, of course. In most cases, these feelings will pass after the regular processing of emotions and by talking things over in your own time with family, friends, or colleagues. When these feelings are intensely distressing and go on for more than 4 weeks, however, it is important to ask for help from a doctor or other health professional, as they may be symptoms of a more persistent condition such as PTSD. About 25% of people who are exposed to traumatic events develop PTSD. As well as being very upsetting, the symptoms interfere with the person's ability to carry on their everyday life, work, and relationships. The distinction between PTSD and complex PTSD is that in PTSD events occur once. However, in complex post-traumatic stress disorder, people are exposed to repeated periods of trauma. Unlike formally recognized PTSD diagnoses, complex PTSD doesn't stem from a singular event, but is instead the result of sustained abuse and powerlessness from which the victim has little hope of escape. However, in some cases, people experience chronic trauma that continues or repeats for months or years at a time. The current PTSD diagnosis often does not fully capture the severe psychological harm that occurs with prolonged repeated trauma. People who experience chronic trauma often report additional symptoms alongside formal PTSD symptoms, such as changes in their self-concept and the way they adapt to stressful situations. Examples of complex PTSD are severe childhood abuse, kidnapping, and being held captive domestic violence, concentration camps or prisoners of war camps. Symptoms experienced are severe and prolonged visual and somatic flashbacks, avoidance of relationships, isolation, avoidance of triggers, several dissociation types, hypervigilance about one's environment, considerable emotional regulation, trust issues, and the inability to easily regulate one's emotions. There are many successful treatments for PTSD and complex PTSD, such as CBT, DBT, or talk therapy with highly trained psychologists. Hypnotherapy has been shown to be highly successful. Recently, the most successful treatment has been EMDR, eye movement desensitization and reprocessing, carried out by psychotherapists. Diagnosis by a psychiatrist is vital, and close observation by a trusted one is crucial to recovery. Recovery from PTSD and complex PTSD is possible through working with a trusted team of professional support and family and friends, plus dedication to your chosen treatment if you find it successful. Don't give up. It may be a long road, but you can recover and lead a fulfilling life once again. For more information on this and other topics relating to complex PTSD and recovering from child abuse, visit youwillbearwitness.com. If requiring further assistance in Australia, contact Lifeline on 131114, Beyond Blue 1300 223 646, and Blue Knot Foundation 1300 657 380.